Tu maru maru no, te tua te whātui aputi, ka titiro hau ki peka peka, ara mai rā te karere, ko pōna turi, uia mai ki hangarea whānui, te tiki tiki o hikurangi, uia mai ki paki paki, te paki paki tanga ahine te. Well, no one but me can fix me. That's the way I see it. I get a lot of support from my children. In fact, I get quite hōhā with them because they're quite bossy and tell me, Mum, you've got to go and do this and you've got to do that and so forth. And so at times I'm inclined to ignore them until the time comes when I have to go to hospital and all of a sudden you're getting stubborn and you're saying to them, I'm all right, I don't need you fellas to take me to hospital. And they're saying, we're coming, Mum, we're coming now. Just be ready. And so you have to listen to them sometimes because they actually do care about you. But because I'm quite an independent person, it's actually really hard to hand the reins over to them because then they just boss you left, right and centre. And a lot of this is actually about my own independence. I'm 70 and I hear people keep on saying to me, we need to keep you well for the next 20 years. That seems a lifetime to me to have 20 years added onto my life now. But at the same time, I know that all this caring and this growling at me is really keeping me safe and keeping me healthy because they want their mother around and their nanny and their great nanny. And I'm Nana Ma, and plus I brought up a grandchild who is now 25, and I'm also bringing up a great-grandchild who is 4.5 years, starts school in July, and she's actually in my care under SIPS. And so I'm still a mum, and I'm still a nan, and I'm still a nanny. And so it's actually really important that I look after myself because after having a meeting last week with SIPS, they're desperate that I keep looking after baby, even though I told them I'm getting older. And so you have to look at that. And so this child I bring up, she's absolutely beautiful. She's got good manners, and I look after her well. And so she's a real joy, and she makes me want to live longer too. With the problems that I had with my husband, that I looked at it, my children only had me. And if I was to fall down, where would they be? Many times I thought, oh, this is not worth it. You know, why do I have to go to work? And, you know, it was about paying bills, keeping your power going, making sure we had food for 8 kids. When you did their lunches, you put all the bread, 1 bread, 2 bread, 3 bread, 4 bread, 5, up to 8 lots of bread. And then you'd put the filling in. And then you put the lid on and so forth. And so it was always what are we going to have? But they never ever starved. And they never ever missed school. Always got into the things that I actually found important in their lives. My kids played rugby. My kids were New Zealand karate champions, 2 of my boys. They could have gone to Australia. My doctor wanted to give them money to go. And that tour was called off. I've had kids played netball. I was the junior netball coordinator for Hastings, so I picked reps for the intermediate kids. The granddaughter that I brought up also, she did tap and jazz and marching, and so did some of my other girls march. And the little baby that I've got, she's done 1 term at gym. She wants to learn to swim, so she can't do that till she's 5. And she's actually a very, very strong kid, no trouble to do forward rolls, jump up on bars without any help and things like that. So it's quite rewarding to see that you can do what I do believe is that the activities, people must give their children activities. Otherwise you find that they go off the rack. Now I'm not saying my kids didn't go off the rack either, because some of them did. But what happens, they still come back into the fold because they knew that I was always at home, that they've got a home to come home to. So that's been the important focus of my life, that I'm the matriarch of my family. and they need me. What I find in my role is when you come into a whānau, it's that rapport. You've got to break down those barriers. There's something there that we have as Māori when it becomes kānohi ki te kānohi. You know, I don't know, it's all that whakapapa and that whakawhanaungatanga that goes on between the patient and myself, as well as the other kaitaka wang. You know, we're trying to weave something together so that we have something in common. That's what I seem to find when I'm working with whānau, is finding what is it that I can pull from that whānau as well as them pulling from me. And then sometimes it happens just like that. We've got a connection, and most times it's because we're Māori. Another example I can, I'd suggest to staff is understand that Māori, we're not individuals. We come as a group. We come as a wider whānau. So it's not just me, my partner and my children, or me and my mother and father, or me and my brothers and sisters. It's me, mum and dad, brothers and sisters, uncles and aunties, cousins, even my best friends. We're like a hapu. It's when something goes down with a Māori on the ward, especially if there's a tūpāpaku, if one of our whānau have passed away, I always say to staff, we got to move fast. If you don't want all these people coming into the room now, then we need to take the tūpāpaku to the end of the ward. So put them in the end room, at the end room of the ward, so that way whānau are just coming to that. They're not troopsing all the way through the ward. So those are some of the tips that I give our staff, like move fast, put them into an empty room, start shuffling the patients around. The staff don't understand that, how do I put this? You've got a patient, and staff will just always focus on the patient, talk to the patient, but actually that patient, like I just said, is made up of a wider, there's a wider whānau hapu that make this person, and so when it comes to discussing treatment or discussing the treatment of this person, it's actually this lot too that they need to consider. And sometimes I feel like they just won't go wider. They just go like, oh no, I'm just going to stick to the patient. That's the patient, and I'm just going to ask the patient. But it's like they don't get that the patient will take the cue from nanny or koro or husband or wife, and so they need to consider that. Some are, but a lot of times they just focus straight on the patient instead of that wider group. It's probably impossible to have one of us giving the message to the whānau, or one of us, being with all these whānau in the hospital and giving out the message. There's just not enough people. So I think education again is with that health literacy, and how do you communicate with people, and because a lot of whānau go, I can bet your bottom dollar he would have went, yeah, I'm all right. No, yeah, I'm all right. Have you got everything in place and you got this? Yeah, I'm all right. But it's not until we come in and then we can dig that little bit deeper. We can get a bit more personal. We can get a bit more intimate with our whānau, and so that's when we find out. It's like we've got to dig deeper. A lot of the nurses and doctors are surface, but we go in deeper and we talk about the whānau, and that's when we find out, oh, his wife is in palliative care, he's got a Down syndrome child, or we find all that stuff. So it's like I've said again, working with that wider whānau, because that's what makes up who we are.
Hey, it's not just me, it's my mokos, it's my mum and dad, it's my partner, it's my children. Yeah, so communication and asking him, had I have come in and says, right, have you got this and have you got that? So who's going to do this? And who's going to do that? What I do find is our medical staff, they do a good job. They do a really good job, but that's all they're concentrating on is the medicine in the wound, whatever they're trying to heal. Whereas myself, I'm, working in that holistic model is, what about your whānau? What about, your wairua, where's that sitting? What about your hinengaro, where's that sitting? And, the tinana, the whole lot. So, yeah, we're fishing. I'm always fishing, finding out about that one, about that one, about that one, about that one. And it seems to give me a better picture of the person, the patient, when I know a bit of that and that and that and that.
Maru maru no, te tua te whātui aputi.